Okay, so this is my IPH-310 topic proposal presentation on binge drinking, and I'm Maddie Crum. First, we're going to start with the introduction. So the significance of this study, binge drinking in college-age students is very high and needs to be decreased. Figuring out an intervention to decrease the amount of binge drinking on a college campus is very important. It's well known that binge drinking is a huge problem on college campuses, and many studies and research show that interventions can help to decrease the binge drinking among these college-age students. The CDC has come out with a lot of data saying that binge drinking is most common in younger adults, ages 18 to 34. In other studies, like alcohol misuse is a major public health concern, and college-age students are the designated high-risk population for future alcohol use disorders. And there have been reports on the urgency of the prevention of binge drinking in adolescence in comparison to trajectory when an adolescence is likely to take with the drinking. Previous research has shown that interventions are helping, but they aren't very long lasting, and they only help for that time being of the study. In one study, researchers looked at the individual versus group brief motivational interventions for mandated students. And overall, like both the group and the individual participants reduced their peak estimated blood alcohol concentration within 1 to 6 months post-intervention, but like they were not significantly different. Penn State put on a study where they hosted events for students during the prime drinking hours to divert their attention from parties. So the campus-led alcohol-free programs were held on prime drinking nights, such as like Thursday, Friday, Saturday, usually the weekends, and it helps the students engage in less alcohol consumption and other substance use because they're doing other events that are alcohol-free. And there have been like other studies with like blogs and online, reaching out to the online community to determine like what's the best intervention for an online community of drinkers. And it was important for these like authors and other like studies to like reach out to subgroups specific to the college campuses. Some research gaps. Every study was different. The study interventions kind of died off and weren't long lasting. None of the studies that were looked at were performed on small private campuses, and they're focused primarily on large universities that were public. The purpose of this study is to figure out the most successful type of intervention for binge drinking among the college-age students on Alma's campus specifically. Aims and hypothesis. Aim 1 is to determine which intervention group or individual will have the greatest effect on binge drinking behaviors. So group interventions are thought to have a more beneficial effect on binge drinking behaviors in college students. Aim 2 was to determine if in-person or online interventions are more beneficial to decrease the binge drinking on the college campus. And hypothesis 2 was in-person interventions will be more beneficial. And aim 3 was to determine if the setting has an impact on the amount of alcohol consumption. So for hypothesis 3, students who drink with a large group of friends will consume the most alcoholic beverages. Limitations of the study. Currently with COVID, many people are not going out and partying as much, so the results will be different, like studying it right now. And also 18 to 20-year-old students that are like underage may not admit to drinking. Also, this study will be performed on only Alma's campus. Now, the delimitations, like obviously we can't fix COVID, but for the study specifically, you can focus on the anonymity of each person. So you could assign like numbers and names to ensure the anonymity of the results. And possibly you could look to explore like other horizons and widen the spectrum of other private universities. Definition. So binge drinking is defined as the pattern of alcohol consumption that brings the blood alcohol concentration or BAC level to 0.08 or more. The pattern of drinking usually corresponds to 5 or more drinks on a single occasion for men or 4 or more drinks on a single occasion for women, generally within 2 hours, which is a lot of drinks. So for the methods section, the study being performed will be a randomized control experiment. Variables of interest, the independent variables are going to be the intervention, so either the online versus in-person or group versus individual. And then the dependent will be focused on the drinking behaviors, so number of drinks during the week, number of drinks in one sitting, number of drinks on the weekends. And then extraneous variables will be like the setting that the drinking's taking place. Materials and equipment. We'll use an electronic survey will be used. There will be an online website intervention that will be created, and handouts and worksheets will be used for the in-person intervention. So off to the side is a questionnaire, which is the primary screening for the study. Participants will be current Alma College students ages 18 to 24 years old. These are students that will admit to drinking alcoholic beverages on the weekends or during the week on campus. And hopefully there will be like 100 to 300 participants that will be recruited by advertising at Saga or by sending out like a mass email for people to take the online screening survey. And so for the procedure, that screening survey will ask questions pertaining to alcohol use and will help us weed out the students. So that's how the students will like first come to know about this study. The study will then, or from there, we will take the students and divide them into 4 groups randomly. And the size of the groups depends on the amount of participants, but the 4 groups will be group, individual, online, and in person. From here, the students will go into those 4 groups and focus on an intervention, whether it's a website or a PowerPoint presentation with handouts in person, whether they'll be alone doing something or in a group. It will be about an hour-long intervention, and participants will fill out another survey each week for a month to see if their binge drinking behaviors have changed and which intervention is best for a small campus like Alma. So this survey that they'll fill out will ask them like how much did they drink during the week and whether their drinking behaviors have changed. Statistical analysis being used for all 3 of the aims. An independent sample t-test will be done. This will figure out the comparison between the different things being looked at. So for the first one, you'll look at the individual versus group intervention to determine which is the best intervention. For aim 2, you'll compare the in-person intervention to the online intervention to determine which is better. And then for aim 3, you'll determine whether there is a difference in binge drinking behavior drinking in a group or alone. So here's the sources, and that wraps up the presentation. So thanks for watching, and I hope you enjoyed it.